Hello, everyone. I am Dr. Sulochana Gurung, your dentist, and I'm here today with another episode of Tooth Talk Thursday. Hope you're all having a wonderful Thursday. It has been a busy week with all the construction happening in full speed. We selected the lights, designed our cabinets, ceiling, so I'll be ordering my beautiful chandelier for the waiting areas tonight. So that means we are coming closer to getting ready to see you all, and I cannot wait. So, can you do me a huge favor? What part of town you're watching me from? That way, at the comment section below, that way I can see like you're here. I would like to share a little bit about our practice. As you all know, we are a brand new dental office here in the heart of Queens, New York, and our goal is to serve our community, treat our patients with beautiful, natural looking dentistry using top of line technologies. And we commit to giving you an exceptional wow experience and creating beautiful smiles. As I see a lot of patients complaining, why is my tooth yellow? Why is my tooth dark? Why is my tooth like discolored, right? So if you have any questions, you all can write them in the comment section below, and I'll address them as they come. So now you know the topic for today is tooth discoloration. So let's talk about tooth discoloration. Um, as many of you know and see, our teeth are white in color. We all call them pearly white enamel or tooth, right? The whiteness that we see in the color of our is the color of our outer layer of the enamel. It is not always determined by the color of the outer layer though, but also what is inside of the tooth. Like I said in my past video from last week, today is made of tooth is made of tooth is made of many layers. The top layer is the enamel, and there's dentin next, and then the core, the pulp, is the tooth that is the component that gives life to the tooth. So uh, the discoloration can happen from a variety of reasons. Most common ones are environmental factors, like the color from the food we eat, drink, coffee stains, drink from the color from sodas or anything that we eat or drink, right? So tooth enamel is very porous. That means it has those little tiny pores on top, through which, like the colors can seep into the tooth. That means it has this absorbing capacity, and that leads to tooth discoloration. Sometimes dental caries, or cavities that we discussed last week can oftentimes give dark color to the tooth. Sometimes there are small microorganisms called chromogenic bacteria in the mouth that when they digest food, they tend to release colored residue. So that also gives the tooth discoloration. Improper brushing, right? So as we discussed in my first episode, you got to brush your teeth. So the one of the reasons is, again, in order to avoid that discoloration. So what happens if you don't brush your teeth well, or if you don't brush your teeth at all? So there will be like a slimy layer that's formed on top of the teeth, and so as it continues to grow, you'll lose that shiny white appearance of the tooth. So again, that can be, so that can also cause the discoloration of the teeth or tooth. Uh, Sometimes discoloration can run in the family. We all have different genes in our body. So if my parents or my grandparents or somebody from my dad's side or mom's side, they have this genetic disorder or genetic genes genetic disorder, or genetically, some have darker teeth, some are lighter teeth, so they all can also contribute to discoloration of the teeth. So talking about the condition, right? So some people are born with conditions uh, which they have defective enamel and dentin, so it can also cause tooth discoloration. So it's kind of unfortunate that happens, but again, there's there are patient population who has that condition too. So over a period of time, as you age, what happens is the top layer, the enamel layer, tends to wear as you eat, as you brush, as like as it just undergoes natural wear. So it can, so it starts showing the inner yellowish layer called dentin. So in that instance too, as you age, the discoloration happens. Sometimes the antibiotic that we take for any condition, antibiotics like tetracycline, when taken during pregnancy or kids under age of 8, when their teeth are like not completely formed, and they tend to stain the teeth too. So again, they are called tetracycline staining. So that's where, in order to avoid that, it's better to avoid, in order to avoid the discoloration, it's better to avoid certain antibiotics during a certain age. Another reason can be trauma to the tooth. When there's a blow, there's an accident. Or when a tooth gets hit by something, or gets hit. So that's where. So what happens then is the pulp that provides life to the tooth. It kind of shakes. It has hemoglobin in the hemoglobin in the blood kind of like deteriorates, or it changes color, leading to, which will be seen through by the different layers of dentin and enamel. So it causes discoloration too. As you, okay. And again, sometimes the dental materials, like fillings that are darker, for example, silver filling known as amalgam, it kind of leaches into the tooth too over a period of time, or when they're like there for a long time. So making the tooth appear dark. So here's a fun fact. So it's sometimes, like the silver material, it sometimes goes into the gums and causes condition called amalgam tattoo. Have you ever heard about any tattoo in the gums, the mouth? That's strange, right? So it is. It's fun to know about that tattoos in the mouth. I was surprised when I read it first about in my when I read about it first time in my class. So yeah, amalgam tattoos are possible too. There was like a dark discoloration in the cheek and the gums caused by the fillings. So yes. So are you guys enjoying it? Isn't it fun to know a little bit about our teeth each week? So hope you guys are enjoying. So for more fun and updates, stay tuned. And I have to announce I have this big surprise coming your way this Monday. And do not forget to tune in, okay? So yeah, hope you guys enjoyed it. Okay, so now I can go ahead and, so I'd like to, oh, that's my little baby in the background. Okay, so, okay, wow, so there are a lot of questions here. Yeah, hi Mike, hi Simi. Okay, so yeah, let's go over the question. So the first question is, how can we remove coffee stain on the teeth or tooth? That's a very good question. Um, so yes, like I told you, like stains from the coffee and coffee, they give the tooth like a little darker appearance, right? So what happens is it's not something that that you can just coffee doesn't stain the teeth right away. So let me just like frame it this way. So coffee, it doesn't stain your teeth right away, but what happens is, like I told, like I said in the beginning, over a period of time, because they tend to like seep into the teeth and the gums and teeth and the dentin, the enamel and the dentin, and that's what is that what releases that color, that, and causes the tooth to darken. So what you can do is, apart from regular brushing or the routine professional cleaning, there are options out there to, to whiten the teeth using various bleaches. You can do it at home. You can do it, at the dental office. So again, if you're planning on bleaching your teeth or whitening, I would highly recommend to be done professionally at the dental office. And if you're doing at home, so you can use like a little milder concentration of the whitening gel at home. So again, if that is something you're interested in, we can always discuss that. And when you come to visit me, we can offer that treatment in our facility too. So yes, I'm very excited for that. Okay, let me see another question. Oh, okay. So here's another question as well. So how often should we do tooth whitening? I mean, professionally. That's a wonderful question. So like it's not something that like it needs like, oh, you have to do it every 6 months, or every month, like monthly or yearly. It completely depends on how stained your teeth are, how much of the whitening you gain from the first time. So that's I mean, I was planning on discussing in my next video, but I'm glad like I was able to like you guys are asking this question so I can address it. So what happens is eventually like when you whiten your teeth, before whitening we take the shades of the teeth, and then we take one after whitening. So we try to compare. And so then like what happens over a period of time is, again, once you start going back to your coffee drinking habit, it tends to go back, and again the tooth tends to absorb those colors, right? So after the whitening is done, there are certain options available. I send you home. Sometimes I send you home with like an in whitening tray, an in-house at home whitening trays. You can use that, and as you see that the teeth are being discolored, you can use that for some for some last minute parties or occasions. Or you can like see, if you would like, you can always, if you think like it's not helping you, or um, so if those touch-ups are not helping you, you can always come to dental office and get it done. So I think like I've done wiping one of my patients like every 6 months too, with like after every cleaning. So they were I think she was basically person in media, so she needed to she wanted to have that like white teeth all the time, so I think she was getting it done frequently. uh, Whereas there was a patient where I think she did okay with like a yearly, like annual whitening, and we were just like giving her those the at-home trays to wear at home for any kind of touch-up that needed. So she did okay with that. So again, look, every situation is different, every individual, every teeth are different. So if that is something you're interested in, you're always welcome to our office, and we will address that personally. Okay, well, thanks. Great question. So let me see another question here. Do you recommend whitening toothpaste in the market? Are there any side effects? That's a very good question. So like all, I mean, if the toothpaste are present in the market, I believe they are FDA recommended. That means they should probably list what they have, the side effects of the products are. I do not, I do not think there are any side effects with the whitening toothpaste available in the market. Again, if your teeth has to have any sensitivity, it's not just the toothpaste that's causing it. There are a lot of other factors leading to sensitivity too. Sometimes, okay, so there's whitening toothpaste. Yeah, I mean, if you are, if you would like to get like a whitening, um, just any kind of toothbrush is fine. Again, the whitening ones, they have a little bit of a more component that the component that dissolves the stain. So yes, if it's helpful, you can always use it. Thank you. So hope that answered the question, Movichu. So let me see. Okay, so I'm gonna have to announce that there is so I have a big surprise coming your way this Monday. So do not forget to tune in, and I would love to see you all. And I'll come back with more construction updates. And again, if you have any questions or concerns, related to dentistry, you can always ask me by email, messages, and I'm getting a lot of those. So hope I was able to answer those questions. And again, I did not have a set date to open, but we should be, opening pretty soon. And yes, I'm so excited. Hope you have a wonderful night, and we will see you all soon. Bye bye. What should we say or do we?